ICU beds in Mississippi are full. Doctors are turning away transfer patients. One hospital describing its staff as stretched thin, exhausted, and running on fumes. Meanwhile, doctors are worried that Mississippi residents still are not taking the coronavirus seriously.
Please don't make this worse for us. And I think that there's that group of people in Mississippi, maybe with the mask mandate that just went into effect yesterday, will start to be more serious about it. But there's a big group of people in Mississippi who just, their lives have not changed at all.
NBC News correspondent Ellison Barber outside the University of Mississippi Medical Center in Jackson. Ellison, the doctor you spoke with says her staff is just exhausted. What is happening at that hospital today?
Yeah, just if you hear some of the noise, we are just seeing a helicopter come in and land on top of this hospital. A reminder, the loud noise, a reminder of how important this hospital is, not just for people who live in the area of Jackson, but really the entire state. The University of Mississippi's Medical Center is the only hospital in the state of Mississippi with level 1 trauma care. They are the only hospital in this state that does transplants. Right now, with all of the COVID cases, they are overwhelmed, overburdened. Their ICUs, according to doctors we have spoken to, they aren't just full. They actually have a deficit. They have more people waiting for ICU beds than ICU beds they have. Really quick, I do want to show you on the hospital here. If you look in the windows there behind me, each of those windows, you see those silver things, those are ICU rooms that have been converted to negative pressure so that they can treat patients with COVID-19 and safely keep that air from going into other parts of the hospital. This hospital started making those changes to those rooms in April. This is a fight, a battle that they are still very much in the middle of. If we walk a little this way, I want to introduce you to one of the doctors here. This is Dr. Alan Jones. He is the clinical director at this hospital, also an emergency room physician. Dr. Jones, thank you for coming out here. I know you have been inside working all day today. Can you just give us a sense of what things are like inside your hospital right now?
Well, it's pretty hectic. Lots of patients. Coronavirus really just makes everything much more complicated. Even patients that present without the typical symptoms we have to be concerned about. It makes the ability to care for the patients more difficult, more meticulous, and it just wears the staff out, having to do this day after day.
What are your other doctors, nurses telling you as they are dealing with this? I mean, I understand you guys have been pretty stretched, not just for a couple days, but for quite a few weeks now. How are they holding up and how are they managing to push through? When you look at Mississippi statewide, and you guys already don't have a whole lot of physicians here, you have the lowest amount of physicians per capita compared to all the other states. How do you balance that with the need, and how do they maintain kind of their emotional composure through all this?
Yeah, well, it's hard. I mean, you know, we started this in March. We kind of were running a race, getting prepared for everything. We had a little bit of a lull, and then pretty much a steady uphill climb since then. And it takes a toll physically, emotionally. I think the most difficult thing is that we feel like we're running a marathon with no finish line in sight, or every time we think we see one, it disappears. You know, the thing we're worried the most about is our staff. Our nurses are tired, our physicians are tired. It takes a lot out of you to deal with this day after day. And, you know, to think about how the lag between case positivity and then hospitalizations and then death, we know that there's probably a 6 to 8 week window where all those follow each other. It's just exhausting. And the thing that we worry the most about is just our staff's resilience.
What do you need people to do to help you right now?
Well, really, we need people in Mississippi to stay inside, stay away from each other, stay out of bars and restaurants and gyms, wear a mask, keep away from each other, and really try to do their part. We've heard it said, and I think it's really the correct thing, and that is we're the last line of defense. They're the first line of defense. If they do what they need to do, they never even see us. So really listen to these things and try to take them to heart.
Thank you, Dr. Jones. And Allison, the soundbite you played just a minute ago from Dr. Luann Woodward, when I was talking to her yesterday, she said one of the things that keeps her up at night right now is PPE. She said they have enough protective equipment for their doctors and nurses right now and for tomorrow, but what she's worried about is what happens come regular flu season when they get to October. She says right now They are preserving some N95 masks so they can sanitize them in the event they need to tap into that extra stash. She says she hopes it doesn't get to that point. But that's one other thing that as they're trying to look ahead into what Dr. Jones said, the idea that there's not a clear finish line here where they're trying to stay on their toes. Yeah. But there are a lot of different factors and a lot of evolving things every day. And you look at just the cases right now. I mean, Mississippi, there's only 2.9 million people living in this state. They have one of the highest per capita death rates right now, and their per capita new infection rates put them kind of in the same category as Florida. Allison?
Wow. And from everything we've heard, Ellison, it does not sound like things are going to get any easier as we head into fall. Thanks to you, and our thanks to Dr. Jones and all of the doctors there who are just working so hard to keep people alive and keep them healthy. Thank you. Weekly jobless claims out today, the lowest they've been during this pandemic at 1.186 million, but the labor market is still struggling. This is the 20th week in a row those claims have been above 1 million, and food banks across the country are feeling the pressure. NBC News business and technology correspondent Jolene Kent is outside a food bank in Paramount, California. Joe, let's talk about what we saw in that jobless report and how it's translating to food banks like the one where you are right now.
Yeah, we see that 16 million Americans are still actively collecting unemployment. The good news is that number came down, the jobless claims number from last week compared to the prior week. But like you said, we're in the 20th straight week of claims above 1 million, and that is something that has been unprecedented. And we're really feeling the effects of that here at this emergency food bank setup here. It's a drive-through situation, and Sam's going to show you what we've got here. We have some fresh produce. 20 pounds of this goes to each household, along with some dairy products here, and then you've got 20 pounds of pre-cooked chicken ready to go in tomato sauce. And then you also have some shelf-stable food as well. And the food bank has been telling me that they've had to increase their capacity in their warehouses for packing and refrigeration because the demand is so high. 80% is how much demand has shot up over the pandemic so far. But what you see is a very long line of cars. And what you see here, Allison, is just the beginning. This is the good part of the line, the very end of it, right? It wraps all the way through this movie theater parking lot, out to the street, down 8 blocks there. And when we've seen people come humbly accepting this food and saying that it's going to be helping them and their families. But this is a food insecurity issue because you have two things happening. You have a vast unemployment crisis, and then you have food prices going up. And so you see food prices going up for meat and poultry and eggs in particular, and that's really the double whammy that's playing out here in Paramount, California.
All right, so, Joe, we had some big news today. Obviously, those weekly jobless claims. Another big day tomorrow. We get the July jobs report. What should we be watching for there?
Yeah, the July jobs report is coming out tomorrow, and we're really watching this to see if the economy improved. We expect only 1.6 million jobs to have been created, which would be a significant downshift from June. The unemployment rate is expected to come down, which would be good news, down to about 10.5% here. So we'll be watching to see how the Federal Reserve reacts to that news. But I can tell you, based on just being on the ground, talking to people all across the country who are feeling the effects of unemployment directly in their homes, those numbers may say something, but they're backwards looking. As we look ahead, we're expecting thousands more furloughs, especially from the airlines, lots of different companies restructuring entirely. So we expect, and the food bank directors that we've been talking to, expect these lines to continue for a while. That's why they're investing in more real estate for those warehouses to make sure they can meet what they call an unprecedented demand. And as one food bank director put it to me, it's like a natural disaster and an economic disaster rolled into one at the same time for a long time, unfortunately.
What an amazing way, but to describe it, Joe. But what a tough thing for people to actually be going through. A lot going on. Thank you so much, Joe. Appreciate it.
Thanks, Allison.
President Trump falsely claimed kids are almost immune from COVID-19 yesterday, so they should go back to school. Here's what Health and Human Services Secretary Alex Azar said about that today on MSNBC.
but I think we've seen in the 50s nationwide, even with as many cases as we've had in terms of fatalities of children, and often associated with a severe comorbidity. And that's nothing to celebrate. We don't want a single child to die, but in proportion, I think it does help reassure parents a lot about their kids and the severe and the likelihood of severe consequences of infection for our children. We don't want them to get infected, of course, but it helps as we as parents think about this.
Dr. Kelly Henning, public health program lead at Bloomberg Philanthropies and a CDC-trained epidemiologist, joins me now. Dr. Henning, thanks for being with us. Given what we just heard from Secretary Azar, what is your top concern about schools reopening?
Thanks, Allison. I think we really have to think about schools as part of the greater community. It's very important that we realize schools aren't islands. They're not all by themselves. They're part of what's going on in the community at large. So in communities with large transmission, where there's a lot of person-to-person transmission of coronavirus, those schools will be riskier, and it will be more difficult to open those schools. And I think the other point that we all want to make is that we have to make sure that students and teachers and administrators who attend these schools, those who are vulnerable, are protected. So we have to make sure that we put in place everything we can to make school openings as safe as possible.
In places where schools are open, we are seeing some instances of kids and teachers testing positive. What kinds of trends, what do you look for or want to see in an area before its school districts decide to reopen?
A lot of communities are looking at test positivity rates. So among all those people in the community that have been tested, what proportion actually are positive for coronavirus? And we'd like to see those percentages down in the 5% range or in that general vicinity. When you start to get test positivity rates up in the 7-10% range, then really a lot of concern about the transmission, the potential of schools being a focus of transmission. We don't want cases in schools, although most children, particularly young children, do relatively well. They don't seem to have as much serious illness. They can get sick, and they most certainly can transmit the virus to others. So there are a lot of things to take into consideration as we start to think about safely opening schools.
Dr. Henning, the president said yesterday kids are almost immune. Can you fact check that for us? What do we know about kids and COVID?
I'm not certain what kids being almost immune actually refers to. I mean, children certainly get infected with coronavirus. Certainly, they tend to have milder disease, particularly younger children. And they do have virus that they shed in their nose and in their saliva. So they do get virus in their secretions. So immune, I'm not entirely certain what the president is referring to there, but I do think that we do feel somewhat reassured that younger children get milder disease when they're infected, and that's a good thing. But we do want to make sure that we have all those things in place in schools that we need. The children have some distance between them, that there is mask wearing, that teachers are well protected with masks as well, that there's very good hygiene, lots of hand washing, and lots of cleaning of schools, and that as best as possible, small groups of kids are kept together so that we know who's in contact with who, and we know how to find children and school staff that may have been in contact if a child becomes positive.
Secretary Azar also addressed testing today. He said half the tests happening right now are rapid tests where you can get results the same day. How accurate are those tests, and how important is rapid testing?
Rapid testing is becoming a very important discussion point for a lot of people because we're having such difficulty in getting turnaround or results back from traditional PCR tests that we've been talking about for months now. So there is some discussion about maybe there's a role for rapid testing. And these are really antigen tests. That means that they test a piece of the virus, not the entire virus. And they can usually give results in about 30 minutes or so. But the difficulty is that we do see false negatives with these tests. And in the early testing routines, maybe even 50% would be false falsely negative results. Now these tests may be getting better, but it is not entirely clear where they fit in. Although the fact that you can get the results right at point of care, like you do for a flu test, if you go to a doctor's office and you have symptoms, may make them helpful in certain settings.
Dr. Henning, on CNN this morning, Dr. Fauci said he still thinks that the U.S. can get the coronavirus under control by November. Given our current case count, do you agree? And how do we make that happen?
I think right now we're seeing roughly 53,000 or so new cases a day in the United States. We've plateaued somewhat. There's some shifting around of where the cases are occurring. The southern states having had very large case counts over the last weeks, maybe some shifting into the Midwest now, but overall some plateauing. It is possible that we can get those cases down. We really need to do that as we move into the fall and into the flu season. Right now, even if we're stabilizing too high. So we really need to get the cases down, and we need to use the public health tools that are available for us. The face mask wearing, the 6 feet apart, the no large gatherings, and other things that are available to us, hand washing, hand sanitizer, cleaning, deep cleaning, all those things that we've been talking about for the last months. We need to implement them broadly and really come together and rally around all of those items, and then put in place, of course, contact tracing as the case numbers come down.
Dr. Henning, thank you so much for joining us again, for your advice and your expertise. It was great to see you.
Great to see you.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.